Flu and COVID vaccines are now available to everyone 6 months and older. And as we enter cold and flu season, there are indications it could be a bad one, with high virus activity expected right across the province.
Hospitalizations are still in the hundreds of Ontarians needing medical care, so we need Ontarians to stay protected.
Ontario's Chief Medical Officer of Health says wastewater samples show that COVID-19 infections are on the rise. RSV is also circulating, and while flu hasn't ticked up just yet, it will.
It really takes 10 to 14 days before your immunity builds up. So right now it's so important. We have a narrow window before influenza starts to take off, which we anticipate being in the next several weeks.
Catherine, who had a bad bout of long COVID last year, was among the first to roll up her sleeves today, getting both shots at the same time, something health experts say is totally safe.
I have asthma, so every time I get really, really sick, I have the potential to get bronchitis or pneumonia, and I really don't want that to happen again, so I try to mitigate it as much as possible.
And there are many ways to get vaccinated. The City of Toronto is taking appointments at its 4 mass vaccination clinics. You can book through your family doctor or check in at your local pharmacy.
It's easy. We're open late. You can make appointments. You could drop into most pharmacies. So it's the convenience that's driving all this kind of traffic, and it's the access to care gap that we're trying to close. And that's where I think pharmacies and pharmacists could play a huge role.
Health experts here in Canada closely monitor winters in the Southern Hemisphere to help anticipate what's potentially on the way.
What we saw in Australia was a worse than average year of influenza infections, both in terms of the number of people who got infected and the number of people who had serious illness ending up in hospital.
And this has hospitals here on high alert. Last year, Ontario's healthcare system was overwhelmed, especially pediatric hospitals, as big waves of flu, COVID, and RSV started early and hit all at once. The province says hospitals have received extra funding to help prepare for this season. Additional clinics are running and more pediatric beds have been added. But Dr. Fahad Razak with St. Michael's Hospital tells me staffing shortages persist and the healthcare system is still at risk.
I do think we're at risk of having similar challenges this winter. There's an unpredictable element of it. Of course, we don't know the exact severity of the flu season, the RSV, and the COVID-19 season. We don't know how much they will overlap and exert pressure at the same time. But I think we have to do whatever we can to reduce that risk now, and vaccination is an important part of that.
Shauna Hunt, City News.